the Himalayan nation, which is under the grip of intense coronavirus pandemic. After confirming 2 variants of coronavirus, a new variant has been detected in the country, which is found to be deadly. Since Nepal is so short of oxygen canisters, it has asked climbers on Mount Everest to bring back their empties instead of abandoning them on mountain slopes. A report.
The hospitals in capital Kathmandu are packed, so packed that in many cases, 2 patients share one bed, as a second COVID-19 wave overwhelms the country's health infrastructure. Health experts and frontline medical workers have described the situation as near apocalyptic, as they face shortages of hospital beds and oxygen. The rising number of cases in the country has set alarm bells ringing. The shortage of beds is a common problem across Nepal, which has approximately 18,900 generals, 1,450 ICU and 630 ventilator beds across the country. Nepal's number of doctors per capita is only one of the lowest in the world, with 0.17 doctors per 1,000 people, while India has 1.34 doctors per 1,000 population. The Nepal Mountaineering Association has asked climbers on Mount Everest to bring back their empty tanks to be refilled for medical usage instead of abandoning them on mountain slopes.
Expedition ma जुन सबै क्लाइम्बर्सहरु बेस क्याम्पतिर चाहिँ छ उहाँहरुसँग पनि निष्क्रिय चाहिँ सिलिन्डरहरु भएकोले हामीले प्रत्येक ओनरहरु र अपरेटरहरुलाई पनि हामीले कुरा गरिसकेको छ यो चाहिँ एक्सपिडिसन प्रसाद यो चीजलाई चाहिँ प्रयोगमा आयो भने तपाई हामीले सहयोग गरौं.
The country issued climbing permits to more than 700 climbers for 16 Himalayan peaks, 408 to Mount Everest for the April-May climbing season in a bid to get mountaineering industry and tourism back up and running. Oxygen tanks often get buried in avalanches or are abandoned on the mountain slopes at the end of the expedition.
Our government and city and our public, they have a lot of coronavirus sickness, so they have a problem for oxygen or heart that. We have around 7 summit treks have around 1,000 bottles. So we can when the empty cylinder is come here, we can provide this cylinder to our government, and government will be make a refill for medical oxygen.
Nepal, a poor country of 30 million, has vaccinated barely 2 million people, mainly frontline workers, since it started inoculation on January 27. So far, the country has procured more than 3 million vaccines, including 8 lakh doses from China and 3,48,000 doses from the WHO-led COVAX facility. India also donated about 1 million doses of AstraZeneca vaccine to Nepal and has promised to supply vaccines into the Himalayan nation in near future.